99 Jams Community Matters. Welcome, everybody. Good morning, and I hope you guys are having a great day. It's your girl, Supa Cindy, and this is my first Zoom Community Matters show. But also, for those that are listening to this interview on the radio, you can also see the visuals on WEDR.com under the Community Matters tab. And you can see my amazing guest, and I'm so honored to meet him and also introduce him. I have Mr. Roy L. Hawkins Jr., who is the Senior Vice President and Chief Executive Officer of Jackson Memorial Hospital. Hey. Hey,
Hey,
Roy.
hey, Supa Cindy, how are you? It is an honor to be with you today.
So awesome. You know, like with the title that I just said, I feel like calling you Mr. Hawkins. But no, I'm going to call you Roy.
Please, Roy will suffice.
Roy, welcome to 99 Jams Community Matters. We are so honored because I know your hours have been a lot during this COVID-19 pandemic that has hit us hard. First, I want to get to know a little bit about you. So let's start. Where were you born and raised? Like, where are you from? What is your background?
So, Supa Cindy, here's the irony. The irony is I was born right here at Jackson Memorial Hospital.
No
I
way.
was born right here at Jackson Memorial Hospital. I grew up in Dade County, 305.
Born and raised in the county of Dade.
And graduated from Miami Carroll City Senior High. I'm a chief.
A chief.
Absolutely.
Okay.
And so this is my home. This is my heart. This is where I grew up. So I'm a homeboy, and it is a great honor. It's a great privilege for me to be able to come full circle and come back and serve in a leadership capacity, actually in the hospital where I was born, in the county and the city where I grew up. So it is definitely an honor and a pleasure.
How does a young man that went to Carroll City High in Carroll City, aka Miami Gardens, how do you make it from, Carroll City chief to your position? What did you decide to study in the college, and what was that path like?
That's a great question, and I'll tell you the root of that question is a praying mother and a praying grandmother, right? That's the root of it. And then the community that surrounded me, teachers, principals, mentors, always gave me something to look forward to, gave me a North Star, knowing that I could accomplish and do anything that I wanted to do, that I dreamed to do, anything was possible. And so with that, my dream was to go to Howard University. So left Miami-Dade County and went up to Washington, D.C. and studied business administration. And there really learned the business, when people think of hospitals and healthcare, they really, and rightfully so, think of the wonderful work that the doctors and the nurses and the technicians do. But I tell people every day, somebody has to keep the lights on, right? Somebody has to pay the bills, create a strategic vision, ensure that we're able to execute and operate it, make sure that we have the resources we need. And really that skill set, I learned at Howard University in business administration and management. Graduated from Howard and returned home to FIU, where I pursued a degree in health services administration. And that helped to put the healthcare component to my business administration component I developed at Howard University, and have been in this field ever since I graduated from FIU.
In your bio, I saw that you really got into helping the veterans. Like, how, out of all the, branches of a tree that you could have fell in with your degree, how did you end up with the, helping veterans in veterans hospitals? That's amazing.
That's a great question. Growing up, I knew a lot of veterans. My grandfather was a veteran. A lot of his friends were veterans. And so that gave me that exposure. That gave me the reverence for these men and women at a very early age that allowed me to really appreciate and honor them. And actually, while I was at FIU, an opportunity presented itself for me to have an internship at the Department of Veterans Affairs, which is actually across the street from Jackson Memorial Hospital. So my first job is across the street from where I'm at today. And, I started there with only, thinking I'd be there for a summer, working through a few projects. And really the mission, the sense of mission and pride that you feel working for the VA, serving these men and women who have served our country, is quite like none other. So I spent a number of years there and actually moved around the country working for the VA. And like people say, I cut my teeth in that system. That system has been phenomenal to me, and I wouldn't change it for anything in the world.
Wow, that story is amazing. So you joined Jackson Memorial Hospital, the Jackson Health Systems, I should say, in 2017. You were working in hospitals like in Tampa, Orlando, Veterans Hospital, I should say, Virginia. So what about Jackson? How did you land at Jackson? Like, was the position open and they just said, I like that guy that we met a year ago at an event? Like, how does that happen?
That's a great question. My family and I were living in Richmond, Virginia. I was working for HCA at the time, and doing what I thought I was living my best life, right?
Okay.
And enjoying living in Richmond, Virginia, enjoying the cold weather and the snow, and literally received a phone call from our corporate chief operating officer, Don Steitman, and Don is well known in this community. He's been in healthcare for quite some time, and asked me if I was interested in the position. And at first I said no, because I'm fine. I'm living my best life. And you know, Supa Cindy, what actually ended up happening is one night I woke up and God spoke to me and said, you know, I've really blessed you to travel all around this country, work in every sector of healthcare. And I didn't do that for you. I did that for you to be able to come back to the community where you were born and raised, in the community that you know so well, to give back. And so it became a personal mission of mine. I started here at Jackson North Medical Center, where I worked for 2.5 years in the actual community where I grew up, because that's right outside of Miami Gardens.
Yeah.
And then was later tapped to come here to the main hospital downtown to run this hospispital. So it's been
that is so amazing. So again, I'm going to repeat your position. Your title is Senior Vice President and Chief Executive Officer of Jackson Memorial Hospital. What does that mean? Like, what is a day in the life of Roy Hawkins? Like, how does that work? Is it so much? Like,
I get that question every day, and I love what I do. I absolutely love, even doing these unprecedented times that we've been dealing with the pandemic. I love what I do, but it's vast. It changes every day. The only thing that is consistent about is that it's inconsistent. But what the most important responsibility that I have is to lead people, to encourage people, to motivate people, to ensure that they have the right resources that they need to take care of our patients. And I enjoy that. That really is mentoring, that's coaching, that's providing feedback, that's elevating people, that's exposing people. And so my number one responsibility here is I'm a chief people officer. I need to make sure that we hire the right people, we maintain the right people, and that they are connecting with our patients. And, you know, I always tell people, my friends who are leaders in other industries, you know, no one walks into my organization happy and ecstatic. You know, everybody that walks into this organization, with the exception of those who are welcoming new lives, our mothers and fathers who are welcoming new lives, the majority of the people that walk in here have a concern. They're pinning a diagnosis, a family member is pinning a diagnosis. They're afraid. And so my job is to make sure that we're being attentive to their needs and that we have compassion, respect, accountability, to care for these people.
You know, I have a confession to make that years ago, I fell on hard times and lost my job and my health care. And I'm diabetic since I was 10, type 1. And I did not know what to do. I thought, you know, okay, let me call the state of Florida and get a Medicaid card. I didn't know what to do. And they said I couldn't get a Medicaid card. And someone told me, call Jackson. And I'm like, well, where do you go? What is that? So I went, got a Jackson card. And let me tell you, in a time that I was desperate, thought I wasn't going to be able to get my insulin, Jackson Health, when I tell you I saw the best doctors, awesome. And Jackson Health, even because I became sick, and Jackson Health was where I got diagnosed with lupus. The dermatologist diagnosed me there, saw my rheumatologist, like, let me tell you something, neurologist, like, the doctors
everything
at Jackson,
from A to Z. Yes.
I've had surgery at Bascom. Let me tell you, I am a Jackson. I wasn't born at Jackson. I was born at Mount Sinai, but I am a Jackson like supporter to the end.
That's what we do each and every day. And what's really, I share with you that I worked for the VA, which is special mission, and that mission is to take care of veterans. I spent some time working for HCA, which is a for-profit healthcare system. And now I think I have the best job ever, because what we're focused on is providing care to anyone, regardless of their ability to pay. And that is the awesome responsibility that we have here. So we have people who are wealthy with all of the insurance and all of the resources in the world. And we have people who, who have fallen on hard times and really need a hospital system like Jackson. And the beauty of it, I'm glad you mentioned it, is the healthcare that we provide regardless of your ability to pay. And so that's the awesome mission.
That's what, honestly, like they based it on what I could afford to pay, my insulin, I picked it up, my medications. So now we're like running out of time soon. So let's get to the business. Okay. Right now with COVID-19, I know some of my people that I'm aware that are acquaintances of mine, I asked them, like, I'm about to interview someone very important at Jackson. Are there any questions you want me to ask? One of the questions that someone told me to ask was, because of the pandemic, their appointment that they already waited some time before got pushed back or canceled, I think she said. And she was asking, like, how are you guys delegating the appointments that you had to either cancel, reschedule? Are you aware of, like, how is this working?
That's a very insightful question. And, that's one that I'm sure a lot of people are facing, and Supa Cindy, out of an abundance of caution, and we were forced to cancel these appointments.
Yeah, of course.
To schedule, cancel procedures, those that were not emergent, those things that were elective, that, were to most we classified as routine procedures. Mm-hmm. Now, in doing that, we were very careful. We identified every patient that was canceled and ensured that they have an appropriate date that may be in the future to reschedule. The challenge that we're having is we have been abiding by the governor's ordinance to only see emergent procedures. So this week, we're starting to lift that just a little bit to urgent procedures. And in the coming weeks, those people who've had appointments here will have the opportunity to have those appointments rescheduled. I want anybody within the sound of my voice to hear me say, if there is something that you feel is emergent or urgent, I encourage you to go to the nearest emergency room. But if we give you an appointment that you feel would like one sooner, call your doctor, call your clinic, and ask for that. And we're making allowances. We are in what I'm calling the ramp up phase. So in the next couple of weeks, hopefully by the beginning of June, end of May, we would have rescheduled the majority of those appointments.
Another question, and I'm asking personally because I was wondering, when I would go to my appointments, the waiting rooms for the appointments to see the doctors are about 40 chairs or so, and everyone's just sitting minding their business, waiting for their appointment, or even in the pharmacy. Now, I'm not sure if you guys have remodeled anything since I've been there last. This was years ago, and also the pharmacy has about, maybe I would say about 80 to 100 chairs in there.
Yeah.
With the new COVID-19 social distancing rules and mask wearing and all that, like, what changes are Jackson Memorial Hospital health systems doing?
Great question. Again, a couple things. One, you need to come back and visit us. I'll give you a personal.
I would love. Can we schedule?
We absolutely can.
There. Yes.
We have upgraded this facility tremendously. From our lobbies to our pharmacy to our waiting room. So it's lots of change since the time that you've been here. But with that change, I am personally involved in what I'm calling social distancing, right? So we are walking every one of our waiting rooms, our pharmacy, any place where patients, guests can congregate. And obviously we are separating those areas where possible. If not, we're putting signage in place so that people know that the designated spaces which are appropriate for them to sit as they're waiting or as they are waiting for a prescription and or an appointment. We've even gone as far as to, I don't know if you've been to the grocery store lately and you see the
stickers
dividers
on the floor.
The letters on the floor,
plexiglass.
The plexiglass, yeah. So we're in the process of looking at our high traffic areas and making sure that those things are installed. And these are things that all hospitals are really doing. It's a new paradigm. It's a new paradigm. And we need to make sure that we are not only taking care of the men and women who trust us with their care, but also making sure that we're keeping them safe.
When and that's great news. That's great to hear, because I know a lot of changes probably have to fall into place to honor that social distancing guideline now.
Absolutely.
I can only imagine, but I definitely want to take you up on that tour.
I will. Yep, we'll do it.
So also, I know that when the pandemic hit, Jackson Memorial, is Jackson Health Systems the biggest hospital in South Florida?
It is definitely one of the largest. You know, there as a system, we are one of the largest. You have other systems out there too, but we definitely see a lot of patients here within our systems. Here at Jackson Memorial, we have over 100,000 people that come to our emergency room every year, which is the largest in the community.
So when the pandemic hit, I know on the news, I've never on the news seen the inside of Jackson, but I know like when they were showing New York hospitals and other cities that were hit hard with the pandemic, it came to the point that they had to do what they had to do and even put beds in the hallway. So with Jackson being such a big hospital, did you guys have enough room? Did you guys have to, change a wing or something that was dedicated to a certain ailment and switch it to coronavirus? Like, how did you guys?
Absolutely. That's another very insightful question. So we made some very quick and decisive decisions along with our infection prevention providers, our practitioners, where we decided that we would identify certain units within the hospital. And those are the units where we would house our COVID patients, our COVID positive patients. COVID positive patients primarily are in two categories, Supa Cindy. One is those that are really critically ill. You've heard of folks who've been on ventilators and who had to be intubated. Those are the patients who are critically ill. We created what we call a critical care unit for those patients. And then those are some patients who have light symptoms but required hospitalization. We created medical surgical units for those. So we have about 2.5 units here dedicated at Jackson Memorial for those patients, dedicated staff, dedicated physicians, dedicated technologists to those folks, and really working to take extremely great care of them. Now, you know, as you related to the pictures that were shown across the country and places like New York, who experienced an overabundance of patients, unfortunately, during this pandemic, we luckily were able to control, well, I won't use the word control, we were able to support those who came to see us, who we were caring. So we didn't have situations where we had patients in hallways and had to go those extra miles, extra measures that New York had. We were able to safely take care of patients in the designated units.
I wanted to know, this is like a personal question I wanted to know. I always see on the news Ryder Trauma Center, like when someone unfortunately gets shot or something like that. What is the difference between Ryder Trauma Center? Like, what do they handle and what is ICU? Is that ICU or what is the difference?
That's a great question. That's a really
good question. I want to know.
Oh, that's good. It's the things that I'm sure a lot of people want to know. So Jackson Memorial Hospital is a fully comprehensive hospital with an emergency room for those things that, you know, bruises and bumps, but also heart attacks and strokes. Those come through our regular emergency room. Now, the trauma center takes care of traumas, gunshot wounds, motor vehicle accidents, those things that have severed limbs or where people require immediate life-sustaining activities. Those folks go to our Ryder Trauma Center. Now, when you're in a Ryder Trauma, you obviously are coming in at the highest level of care. You're coming in requiring trauma, ICU level of care. Immediately, most of those patients go to an OR, then they recover in an ICU, and then they do, Supa Cindy, what I call a reverse progress. They go from critically ill to getting better to a med-surg area. And the other portions of the hospital, depending on what critical condition you have, you may end up in an ICU. It's not a trauma ICU. It's an ICU dedicated to either post-surgery, cardiac ICU, or a neurosurgery. Patients who have neurological issues have a special ICU as well. So it's all the same level of care, but very different focal points.
Thank you for clearing that up. I was wondering that.
You need a tour. We're going to make sure we get you a tour. We'll walk you through the whole thing.
And right now, through this COVID-19 pandemic, does Jackson Health Systems team up with other hospitals? Do you guys work together, or how does that work? Like Baptist or whatever other hospitals on their own separate thing, or?
Another great question. So we, hospitals generally have contacts and communication. I know many of the CEOs of other hospitals who are close to us, but during this pandemic, we really have come together as a community. And the first example I'll give you is, there was a number of patients that came into the port of Miami through the cruise ships.
Yeah.
And, collectively, Jackson, Baptist, U Health, we all came together to triage those patients, to ensure that those patients were equally distributed so that we didn't put a particular strain on any particular specific hospital. In addition to that, our president and CEO, Carlos Magoya, has done a phenomenal job with working at the county level, working at the community level to ensure that we're not only partnering with other hospitals, but we're partnered with Miami-Dade County. We've been very instrumental in helping set up the testing sites at the Marlin Stadium, at the Hard Rock Stadium. So Jackson is not only a pillar of the community, but we have been at the forefront of bringing together the collaborative efforts to provide care. And I really do think we sit and we talk about, the number of infections that we've had here. And I think that comparatively speaking, it obviously could have been a whole lot worse. Our collective efforts, I think, of what led to us containing a lot of the pandemic.
That is good to know. I love that. So let's talk about funding. I know it costs a lot to do what Jackson, healthcare systems does, especially now with so many COVID-19 patients that don't have insurance. Who fits that bill? Like, who pays for that?
So it goes back to our core mission, and what I shared with you before is, we provide healthcare to men and women in Miami-Dade County, regardless of their ability to pay. A large portion of that, Supa Cindy, is really connected to a sales tax from Miami-Dade County. So from tourism, from every dollar that folks spend in Miami-Dade County, Jackson gets a small percentage of that to help us treat and care for the uninsured population. And so that has been phenomenal. Obviously, hospitals across this country have lost funding during this time for a number of reasons. And a lot of it's because of that volume you were talking about earlier, appointments and OR procedures, where insurance companies, obviously people haven't been scheduled for procedures, so that revenue has dried up. And so the federal and state government have done a phenomenal job in ensuring that, like the stimulus relief that a lot of the men and women across the United States have received from the federal government, there's a similar thing put in place for funding for hospitals and healthcare systems. And so through our regular funding sources, through those who are insured, and through the support from federal and state government and local government, we've been able to stay afloat.
If anyone is listening or watching and they're interested in making a donation to support the cause of what Jackson Health Systems does, where can they go or find out more information on that?
We have a fantastic foundation. It's called the Jackson Health Foundation. That website is very simple. It's jacksonhealthfoundation.org. Supa Cindy, the community, has been phenomenal. And the donations that we've received, food, time, resources, gifts, masks, from everyone in the community. All of those gifts have been funneled through our philanthropic arm, which is the Jackson Health Foundation, and they are standing ready to receive gifts from anyone who'd like to help support our mission.
That is so awesome. So again, I want to touch on the appointment part of it, of the patients who are not COVID-19 positive, just the regular patients that were going to Jackson Health every few months to see their primary or the specialist that they were seeing. Again, when do you guys are hoping, because right now South Florida is still closed, our numbers are still high.
Yep, for sure.
So are doctors still like seeing patients through the, through their phone, through, what is it called?
Telehealth.
Yeah, telehealth.
Telehealth. So, this telehealth has been around for quite some time. Obviously, during tough times, we all come together and figure out ways how to better serve our population. So many of our clinics, in partnership with U Health, have offered telehealth solutions to our patients. And so if patients call their particular physician, they'd be able to inquire about that telehealth component and ensuring that we're able to see them again telephonically to the telehealth equipment. Again, I want to consistently remind people, particularly those in our community, you know, because we know that a lot of people that look like me and that look like you are suffering and dying from COVID. And so we don't want people to sit around and wait for their diabetes medication and to wait for, you know, to get that preventative care that they need. Know this, and I want to reassure everybody on a couple things. Every person that comes through our emergency room receives a COVID test. So we are prepared to treat, yes, we're prepared to treat you, and it's a rapid turnaround COVID test. So we're prepared to treat you with or without COVID. So do not let that stop you from getting the care. Although your physician's office may be closed, we encourage you to come into an urgent care center or an emergency room that are open 24/7 and ready to provide that service.
That is awesome. So we got to wrap things up. The time just flew by, but can you please give our listeners and our viewers any phone numbers, websites, just so that they can stay connected, maybe get into the Jackson Health System for care, for something they've been putting off and thinking they can't afford it or can't, you know, won't get approved, or, you know, the whole thing.
Absolutely. I appreciate that question and the opportunity. And I just want to tell everyone again, while we are dealing with this unprecedented pandemic, and it really is changing all of our lives, it's creating a new paradigm for us to live in, both from a professional and a personal endeavor. What I would encourage you to do is to take care of yourself. Your health matters. As an African-American male myself, I am deeply concerned about our community and about the effects that this pandemic has had specifically on Black and brown people in our community. And so what I want you to do is just to know that if you feel something, you don't feel that you know your body, and if you feel like you need attention, please go to your nearest emergency room and or urgent care center. If you'd like to request an appointment from many of our multi-specialty outpatient clinics, I would encourage you to call 305-585-4JMG. 305-585-4JMG. And that's for the Jackson Medical Group. That's for all of our outpatient footprint. For those who are interested in reaching out to Jackson Memorial Hospital directly, 305-585-1111. 305-585-1111 gets you directly to our switchboard that can connect you to any of our medical or surgical subspecialties or to our emergency room should you need that. And always there is 911 for that emergency component as well.
You know, it's been a pleasure meeting you. Again, we're speaking to Roy Hawkins, who is, let me read this title because it's big, the Senior Vice President and Chief Executive Officer of Jackson Memorial Hospital. I just want to thank you so much, Roy. I hope you have the time to come back again. I want you to be a repeat visitor to the Community Matters show because you are our you're our plug. Roy, you know that?
That's right. If you need something, call me over here, Jackson. We'll make sure you get it.
Hello, with information and just how to move and maneuver around some of the things that we need to maneuver around.
Absolutely.
So I just want to thank you so much. And again, he gave out those numbers. You can always go to WEDR.com and listen in or view in to this Zoom meeting that we're having. And again, I just want to thank you again, Roy, for joining us. 99 JAMZ, Community Matters.